She is one of the key figures helping those who are on the front lines of some of Canada's toughest jobs. We bring in clinical psychologist Dr. Katy Kamkar. Good morning.
Good morning.
Well, you do a ton of work specifically with PTSD patients, so tell us a bit about your role.
Yes, and thank you so much for having me. Such an important topic, as we know. I do see a variety of patients and clients who have gone through very upsetting and traumatic events for a variety of reasons. And it is essentially providing evidence-based treatment. We do know that there are certainly general population more often than not experience at least one traumatic event in their life. Not everyone goes on into experiencing post-traumatic stress disorder, but certainly there are many risk factors that we want to always appreciate, in that how it does increase vulnerability for any of us to develop symptoms of post-traumatic stress disorder.
Well, let's maybe talk about some of those symptoms, because we know we're in very tough times right now, unprecedented times. What are some triggers? Maybe what are some symptoms that people can look out for in their loved ones?
Yes, we do know that, especially when we look at the DSM-5 diagnostic criteria. So it's really around the actual threatened death, serious injury, or again the sexual violence. Now we can talk about either being directly exposed to the trauma, witnessing the trauma occurring to others, learning that the traumatic event has occurred to a close friend or family member. In that case, it needs to be accidental or violent, or repeated exposure to details of the traumatic event. So here is really around appreciating accumulation of trauma, and then also the notion of the vicarious trauma. Typical symptoms here: re-experiencing symptoms of trauma, so distressing memories. It could be flashbacks, or experiencing psychological symptoms following triggers, or it can also be the avoidance. We want to avoid anything that might remind us of the traumatic event. We also know that often our belief system tends to be shattered, and also the hypervigilance, which is part of the hyperarousal symptoms. So hypervigilance, feeling excessively jumpy, mood irritability, outburst of anger, variety of symptoms. Now, these are also normal reactions that people go through. It's really over time, if the symptoms increase over time, create more distress, and or interfere with our functioning daily activities, professional help, in addition to everything else, would be definitely helpful and recommended.
Well, I have to ask, as you know, a personal point, as a psychologist, how has this pandemic pushed you or had to change your role in people's lives?
We know that, thank you for that question, because as we know, the mental health needs of Canadians have been on the rise with the COVID-19 pandemic. We saw kind of globally and suddenly how our daily life structure and routine has changed drastically. And for a lot of people as well, we know the protective factors was going out, engaging in meaningful activities. So we saw with the pandemic that suddenly the daily activities have changed, and so they have felt that sort of the resiliency also has been shaken up. So, and then of course, with all the variety of stages that we have gone through, continue to go through, the uncertainty and all the fluidity, again, it's a lot of the anxiety, and we know with uncertainty it does create room for more worries and anxiety.
Well, sadly, we have to end the conversation there. It's one that can be very lengthy for sure. If people want, to reach out, get help, they want to find out more about your work, how can they do that?
I say that there are a variety of resources, very important to seek help. Certainly, the Centre for Addiction and Mental Health, the Ontario Psychological Association, the Canadian Psychological Association, variety of resources that provide great resources, helps. Definitely access to help as well. So it's always important to know not to suffer in silence. And we have effective treatment available, and definitely virtual platform as well to more accessibility.
A great message for sure. Thanks for your time this morning and your work.
Thank you so much for all you do.